Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Gynecological infections, vaginitis, Trichomonas vaginitis. Trichomonas vaginitis, the most common organism causing Trichomonas vaginitis is Trichomonas vaginalis. The chief complaint is foul smelling, frothy discharge is seen. Other complaints like the patient will have dysuria, dyspareunia, and pruritus is seen. Discharge mainly includes in Trichomonas vaginitis, the patient will have greenish yellow frothy foul smelling discharge. pH of the discharge is more than 4.5. On per speculum examination, you will see strawberry appearance. Sexual transmission is present, so we will have to treat the partner. Investigation of choice is saline microscopy, where we will see motile flagellated organisms. On pap smear, the size of the organism is same as that of nucleus. Gold standard investigation is culture. Whiff test. Whiff test can be positive or negative in Trichomonas vaginalis, but it does not show, but it is not characteristic. Treatment of Trichomonas vaginitis is metronidazole 500 milligrams BD is given for 7 days or 2 grams stat. The treatment is similar in pregnancy also.
thank you and thank you for watching.